All right, we're going to go around and ask for the moderators to share one, and if you want, two sentences about what was discussed during each of the breakout sessions. So, Amy Verstappen, I'm going to start with you, and you should be able to unmute yourself.
Great. I only had one person in my group who could participate. There were two people there who didn't seem to be able to participate. But what we talked about in terms of an impactful action, this was specifically in Norway, but can be generalized, is that essentially in Norway, there's been very successful collaboration in embedding patient and family voices at the hospital defining needs. And that the patient family organizations were the ones that initiated and pushed for care guidelines in their country. And the single take home in terms of what we need to highlight is that meeting these gaps has to start with the patient family voices, because that's essentially what was shared about this project, is that many of the clinicians' assumptions and actions actually changed when those patients and families were at the table, that they weren't actually understanding what the challenges were, and that's led to really positive change. So that's my sentence.
Thanks, Amy. Sheila, I'll turn to you.
Thanks, Kate. We also had two people, one joined late. I think that collaboration is definitely was a overriding theme, and also the translation of experience in other disease areas. The example is heart failure and stroke, to be used in childhood onset heart disease, using some of the successes and ways that they've done it to use a model. Even it's a little different, but there's some overlap. So I think that's my message.
Thanks, Sheila. Meg, I'll turn to you next.
Okay, so I tried to keep it to the two sentences. So to drive impactful change, we need to rethink how we collaborate by adopting targeted tools that directly support advancing research and improving outcomes. Achieving buy-in across all stakeholders will require a shift towards a more integrated, goal-oriented approach that emphasizes the value each tool brings to the overall mission.
I know it's hard to keep it short, right? Thank you, Meg. That's so many great topics. Patty, I'll turn to you next.
Thank you. I'll read what I have as my sentence. I loved what they said, to make visible what was invisible, and through data and through alliances between the public and private sectors, to make sure that the patients that otherwise didn't have an opportunity are now being treated.
Thank you, Patty. And Patty was in the breakout group that was fully in Spanish, so I appreciate you reporting back for that. Thank you.
No, you're welcome.
Carissa, I'll turn to you.
Thank you. So we talked about the importance of leveraging data and continuing to collect data and use that to make positive change. We also talked about, so my entire group was US based. We also talked about things that other countries are doing that help kind of facilitate bringing awareness to CHD, as well as capturing them into care so that they don't get missed or things like that. So we talked about those things and how the United States can look at ways to support that as well.
Thank you, Carissa. Disty.
Hi, we had two people in our group, one from Europe and one from the US. Both of them were old friends, so that was very fun. Thank you very much. But I think that the big take home was actually very similar to what Amanda said, although she may have said it much better. But the improvements of global health collaboration. I think we've come a really long way, but man, we are probably like just a toe in the water as far as how we have to go. Because I think if we don't collaborate together, we'll be lost together.
Thank you, Disty. Lola, I know that you added some comments in the chat. Was there anything else you wanted to add as well to that?
No, it's ay, reactivar audio. No, it's just interesting to see. I mean, it's just thinking outside the box where, you know, everybody has a different problem, but it's just interesting to understand, try to understand things from the ONG perspective, the patient's perspective, and the medical's perspective to try to find new ideas and solutions. That's it. The rest is written there.
Perfect.
So just, yeah, Liesel gave a very good example about how it worked out for doctors to listen to patients at the World Congress. So,
Thank you. That's fantastic. Thank you.
great, thank you.
Isra?
We also had a couple of people in our group. One was a project in the United States in New Mexico, a group based there, and another organization that works in Latin America. And specifically, we talked about a project in Honduras. Ironically, both spoke about very similar challenges of needing to build more capacity and more awareness among referring physicians. That was one thing. So kids are diagnosed more on time. We also talked about the strength of partnerships and how Global Arch brings a lot of different organizations together under one voice to actually advocate for very similar changes across the board. So I think that's where I'll leave it. Thank you.
Wonderful. Thanks, Isra. Alicia? You're muted.
I also had just one participant, Amaya Saez from Menudos Corazones. We talk about a new collaboration that they have with their hospital, and it's for transitioning patients from pediatric care to adult care. And we talk about how important it is for patients to feel supported when they transition from one type of care to the other.
That's wonderful. Thank you. And Michelle?
Hi, we had two people in our group, only one of which is rheumatic heart disease patient, the other one a retired clinician. So we talked about the value of peer support groups and how they can provide such a fantastic amount of advocacy and support for each other, whatever stage they're at, whatever they're going through. And there was some discussion as to whether healthcare professionals are a help to that, but also the collaboration of different support groups within the same country so that they come together and support each other as well. Similar to what we do with Global Arch, bring patient organisations together, bringing actual peer support groups of patients together within a country, how beneficial that will be.
That's wonderful. Thank you, Michelle.
Thanks.
It's great to hear all the different feedback from all the different groups, but also the similarities across all of them. And thank you everyone for sharing your successes and your feedback. We have added a link in the chat that you can add your success story there as well. And it will be featured on our registry that we are building and will be hosted on the Global Arch website to really share the different knowledge and the successes across the world, and to also connect one another. On that note, I'm going to turn to Sheila Ross to close out today. But very quickly, I want to thank all of you for all of your participation and for sharing all of your knowledge and your expertise. Sheila, I'll turn to you and I'll share my screen.
Thanks a lot, Kate, and thank you very much again, everybody. This has been really, really informative, fun, exciting. We hope that you join us tomorrow for the second day of the virtual summit, which starts at 8 a.m. Eastern Time. Tomorrow is full of exciting presentations and panels discussing the importance of data and advocacy. Please note that your Zoom link will be different tomorrow. Please check your emails. We will send the link again to all attendees, as well as to make sure it is easy to find. If you have any questions, please reach out to info@global-arch.org with any questions. And we look forward to seeing you tomorrow. Thanks again.